This is the second webinar in the series.
The Kind Research Group, isn't it?
Yeah.
So shall we introduce ourselves? Hello, everyone.
I'm Amanda.
I'm Irene.
I'm Sunny. We all work at the Kingston University.
Yeah, we're all researchers here.
Yeah.
Want to introduce this fella?
And this is Pierre. This is our work mascot.
Yeah, he comes everywhere with us, doesn't he?
Yeah.
So, okay, you're very welcome today. We have hundreds of people registered to this webinar, so there's clearly something that you are interested in, so you're very welcome. What we'll do today is to talk about the research project that all of three of us, plus lots of people who are also sitting here in the office, you can't see them, are working on the DAPPLE project. It started, well, when did you start, Sunny? You started work on the DAPPLE project.
Yeah.
When was that?
I think October last year.
Yeah, more than a year ago, isn't it? So we've been going for a little while. It's a 3-year project. And today we are going, this is the first really public webinar and presentation about some of the very early findings from this project. So we have 2 wonderful presentations from 2 speakers who will tell you a little bit about what they found so far. But to begin with, we thought the first thing we'll do is to show you a little bit about the project. Before we do that, we have about 10 minutes left at the end of this webinar, hopefully, for Q&A, questions and answers. So if there's anything you want to comment on or anything you want to ask, then do pop them in the Q&A. We have Freya, Dr. Freya Tyrer is here live to answer questions. She's doing the first presentation. And for the second presentation, we've got Dr. Redmore here as well. So we will look at your questions that if you pop them into the chat and hopefully pick them up later. But first of all, let us just see what this DAPPLE project actually is.
The DAPPLE project.
Hello, I'm Richard.
Hello, I'm Amanda.
Hello, I'm Sunny, and we are researchers.
We are doing the DAPPLE project.
What is the DAPPLE project? The DAPPLE project is a research project.
Research is when you try to find out more about something.
We will find out
What helps people with a learning disability get good care at the end of their life when they're ill and dying.
If people don't get good care, why is that?
what are the top tips to make sure everyone gets good care. Why are we doing the DAPPLE project?
Sometimes the staff don't understand our needs or have time to sit down and talk to us about it.
People with a learning disability never always get the right support. Some people with learning disabilities, it's hard to tell that something is wrong. If you've got something wrong with us, you can't see it, but it's invisible. And also, to add, it's very difficult people to communicate.
It's really important that we get the right care at the end of our life.
That's why we're doing this project.
What will we do in the DAPPLE project?
We will do 5 things. 1, 2, 3, 4, 5. 1. Count the numbers.
We will look on the computer at information, look at 15,000 people with a learning disability who are at the end of their life. This helps us to find out what their health needs are, whether they had the same care and treatment as people without a learning disability.
2.
What do we know about this already? We will look on the internet to see if anyone's found the answers to our questions already.
3. Find out what's happening. We will go to 4 different places in England. In each place, we will find out what is happening with people with a learning disability who are going to die. What helps them get good care? What stops them getting good care? Oh,
Involve everyone and give top tips.
We will work together with a group of 10 people with a learning disability. The group will meet every month to think about what we found out. The group will help to give ideas and top tips.
We will make
Stories of people getting good care so others can learn how to do it.
tips and resources for the managers who decide about the money.
training for staff, professionals and families and carers.
5.
Do research together.
People with a learning disability are part of our team.
We get paid.
The project will take 3 years and we will finish in 2027.
There is lots of information about the DAPPLE project on our website.
Do have a look and follow us on social media. Do get involved and see you
See
soon.
you soon.
Bye. Bye.
Oh, bye and hello again, isn't it? So so that's a very quick overview. There's a lot more on our website if you want to know more about what we're doing, but we didn't want to spend all the webinar talking about the whole project, but just a few parts of it. But we were talking earlier, weren't we, Amanda, about how important it is to have you and some other colleagues with learning disabilities as researchers. Do you want to say a bit more about that?
It's important because we know what it's like to have a learning disability, and we can help other people to make decisions about the end of their lives. But we couldn't do it with people without a learning disability as well, because like Irene and my colleague Fred and my colleague Andrea, because they're really important. We work as a team and we don't leave anybody out.
That's nice to hear, Amanda. And for you, Sunny, this is your first webinar, I think, that you're
Yes, it is.
presenting.
Yes, it is.
And
Yeah.
it's a new job. Well, not that new, but a year ago. What's it like to be working as a researcher on this project?
It's very important, especially coming from a cultural background. They're trying to stop people I like people in my culture, like trying to stop stigma. So make sure every single culture get the good treatment. So we stop people us dying. It's very important. So that's my passion.
So important, isn't it, to include everybody, and that includes you, whoever you are, and for whatever reason you are here and listening and learning. We want to hear what you think, what your questions are, what your experiences are. So keep putting them in the Q&A. Don't put them in the chat, put them in the Q&A, because then everybody can see them. So let us start then with the beginning of this project. One of the first things we started doing, or I say we, it's actually the people in Leicester, at the University of Leicester, and particularly Dr. Freya Tyrer from the Leicester Real World Evidence Centre has been looking at the huge national databases to count the numbers of people with a learning disability who are at the end of life. We also, before we show you that presentation, you, Sunny and Amanda, are in a group that is led by Richard and Fred as well, a group of people with learning disabilities who meet, is it once a month you meet online?
Yeah.
And you talk about what we've been found out, isn't it?
Yeah.
So that was quite a job, wasn't it, when the last meeting when we had to get our heads around all these numbers that Freya had been learning about. So in this presentation that is now coming up, we will show you both some clips from that online meeting of the co-production group of people with a learning disability who are listening to these big numbers and thinking about them. And then in particular, I'm delighted to have Dr. Freya Tyrer doing her short presentation, a summary of the findings from that part of the work. We call it a work package. Bit of jargon there. That's what it's called in this project. Work package 1.
What?
Oh, yeah.
That's
Wow.
too much. Blimey. That's about 1,000 million or something.
Yeah.
Do you know what that reminds me of? This film, Where's Wally?
Where's
Yeah,
Wally?
where's Wally? Where's
Exactly.
the patient?
That's exactly right. And the thing is, we want to know about Wally because we want to know Wally's story. But we also want to know about all these numbers. And this is quite a lot, isn't it? You can't have 1,000 stories. There's too many. But somebody in our team has been counting these numbers, right? It's
Quite a lot of numbers.
quite a lot of numbers.
Yeah.
Hello everybody, my name is Freya Tyrer and I'm a senior epidemiologist at Leicester Real World Evidence Unit, which is based at Leicester General Hospital. And today I'm going to talk about work package 1 on the DAPPLE project, which is about end-of-life care recording in GP practices. And we're often called the numbers people because we tend to work with big numbers. And as well as the DAPPLE team, I would like to acknowledge some colleagues of mine at Leicester Real World Evidence Unit, Joanne Mixer, Francesco Siccardi, Claire Gillis, and Kamlesh Kunti, who's our director. So I'm going to talk through what we did, who we studied, our findings, what they mean, and what next for the DAPPLE project. So for our study, we used healthcare records. We used information from healthcare records, and these were mainly GP surgeries and hospitals. And I will say here that the data that we use, the information that we use, are anonymous. So we don't know personal details about people, like, I don't know, their names, their exact dates of birth or where they live or anything like that. And you can see why we call the numbers people, because we work with big numbers. So we looked at people who had an end-of-life care record in their at their GP surgery. So for example, it could be a diagnosis of end-of-life care, it could be a referral for palliative care, it could be something more process-based, like being put on an end-of-life care register. But what we did is we took the first of those records in primary care and we followed up people, looked at their journey after they'd had that first record. And we had big numbers. We had more than 2,000 people with learning disabilities who had one of these end-of-life care records. And we had 300,000 people, or just a little bit over, of people without learning disabilities, who we used as our comparison group, if you like. We wanted to see if there were differences between the two groups. So our first key finding was that people with learning disabilities didn't live as long. After they had their first end-of-life care record, they didn't live as long as those without learning disabilities. So if we look here at a week, we find that around a quarter of people with learning disabilities died within a week of receiving their record, compared with around a sixth, so a smaller proportion of people without learning disabilities. And we don't think this is enough time to prepare. Now, our second finding was interesting. People with learning disabilities tend to have a range of complex conditions and health needs, but we found two particular conditions, dementia and dysphagia, difficulty swallowing. They're already common among people with learning disabilities, but they were much more common in those who were approaching the ends of their lives and had an end-of-life care flag. So this was, I'll talk through the implications of this in a minute, but that was an interesting observation. And our final key finding was that people, after receiving one of the end-of-life care flags records, people with learning disabilities were less likely to be admitted to hospital, They generally had fewer GP appointments. It wasn't that large, the difference, but it was what we would call statistically significantly different. But we found quite similar proportions of people who were referred to specialist palliative care services. I have to say, I was surprised that was quite low, but the DAPPLE team weren't that surprised that it was low. So the implications of what we found are we'd like to see better identification of end-of-life care for people with learning disabilities, to give people and their families as much time to prepare as possible. The findings about people having difficulty swallowing and dementia is interesting because they tend to come with communication problems, with difficulty speaking or asking for what you want, which can be really hard at the end of your life, because you want to be able to communicate what you want to say. So we wonder whether communication experts like speech and language therapists or specialist doctors could help. They're already really important, but whether they could really help people at the ends of their lives. And we're also interested in why people with learning disabilities aren't seeing doctors or going into hospital as often. We're not sure if they're treated somewhere else or really what's happening. So we'd like to know more about that. And we think that's a really important thing to look at for the future. So as well as doing future work with the numbers, I think our future work also needs to talk to people with learning disabilities, family members and healthcare professionals to learn much more about what's going on and get a much greater understanding of people's experiences and how end-of-life care is and currently. So I think we need to look at that. Okay, thank you ever so much for listening, and I'm happy to take any questions. Thank you.
Yeah, Amanda, that's exactly how I was feeling. Maybe we should not make it sit like this.
Confused.
Yeah. People with a learning disability and end-of-life care needs were less likely to go to hospital than people without a learning disability. What do we think about that?
Because it depends on how the patient is ending their end of life care.
We've just been chatting, haven't we, Jordan?
We've just been have a chat, and then I think that people should stay home with the patient, and then
is that because you are surrounded by the people that you know and that you feel comfortable with, rather than being in a hospital with people coming and going that you don't really know, and if you're at home you're in an environment that's familiar with
comfortable,
you. Yeah, I get that, George.
Stay home and then get pain under control that way, rather than going into hospital.
Because I find that difficult. When I go into see the GP, they don't have like pictures, they just have notes that they write down. But I think we need to have pictures for people who can't read, and then it's easy for people to go into the hospital.
Not many people were referred to a hospice.
I'd rather be at home than be in a hospice.
So you'd rather have the support from the hospice nurse here in your home, or is that what you're saying?
Yeah.
Right, okay.
Can I ask you one more hat question? Put on your hat if you're still a little bit confused.
That's everyone.
Russell, have you not got a hat on? Are you not? Oh, he's confused. Right, is that everyone? Are we all confused? And Amanda's even got her confused picture out. Okay, so we've listened to all these numbers, and we're still a little bit confused. We have lots of questions, don't we, about the stories behind this?
But it seems to me that there seems to be a bit of a gap between people, able-bodied people, and people with learning disability. But I think that's one of the big questions we've got to find out. Why is there a bit of a gap between, that an able-bodied person and a person with a learning disability? Is that our support and care is just as important as your care, Irene, or Fred's care, or Joe's care, or anybody, and everybody, but
So numbers, God, to be thinking of numbers this afternoon.
Quite.
Thank you, Freya. That was really good, but it was very confusing.
I know, but we were all a little bit confused. Well, it was and confusing, but also, I don't know about you listening to this out there, but we had so many questions. We wanted to know why and what the stories were, and is it a good thing or not a good thing that people are not going to hospital so much? As we could hear from Jordan, he didn't like going to hospital, he would rather be at home. But is it for the right reasons? So it was a really interesting. I really thank you, Freya, and I realised how important to count the numbers and then to think about what it means. And to think about what it means, you've got to really go out there and listen to some stories and find out what's happening. So that's been going on in another part of the study. I'm delighted to now introduce Professor Louise Wallace from the Open University, who has been going out and she'll tell you about this, but to 4 different areas in the country that we're working very closely with in the DAPPLE project, to listen to what managers and senior sort of leaders and commissioners have to say. There is more coming in the project. This is not the only thing. We're also going to listen to people with learning disabilities, to families, but we won't be able to tell you about that quite yet. Let's first of all listen to what Louise has learned, and then after that, her colleague Ned Redmore is here too, who also worked on that part of the project, to help answer any questions you have about that.
Good morning. I am Professor Louise Wallace, and today I'm presenting with Dr. Ned Redmore of the Open University. We are presenting one part of the larger DAPPLE study. We look at how do services plan for end-of-life care for people with learning disabilities in England. The study is funded by the National Institute of Health and Social Care Delivery Research, and the views expressed are those of the authors and not necessarily NIHR or the Department of Health and Social Care. While we know quite a bit from people with lived experience and families about how services are experienced, we know much less about how people go about planning these services. So what we wanted to find out was, how do services plan for end-of-life care for people with learning disabilities? We also wanted to know what services find difficult about planning for end-of-life care, in particular for people with learning disabilities. And also, can we find out what services find that works well so good practice can be spread more widely? We looked in depth at services in 4 areas of England, which are West Yorkshire, Leicestershire, Milton Keynes and South London. I asked our team to suggest people in charge of planning and paying for services in these areas, including those in learning disability services and palliative care, general hospital and community hospital services. I interviewed general practitioners, specialist nurses and service managers who run services, and commissioners who pay for them. We found services need to be able to know people are nearing end of life. A senior learning disability nurse said, "You can't just hit the end of life care button." Services need to know how many people they have at end of life care and what their needs are. But we found little evidence, for example, that either learning disability commissioners or hospice services record such data. A GP said, "I don't know how many of our patient cohort have a learning disability. I've not seen that data." Services need to support people to plan for the future, and to do this, they need to know what to do when people's needs change. But because this is not recorded in such a way as service planners can understand the changes in need, these needs do not inform service planning. Healthcare professionals often don't recognise changing healthcare needs in people with learning disabilities. It's not always obvious with people with learning disabilities who may already have a lot of health conditions, but the pattern should ring bells. A learning disability nurse said, "Hold on, you've been to hospital 5 times with this. Do you think that we need to have a plan if this gets really bad?" But that didn't happen. Sometimes this can be because they're young, but have conditions older people often don't have. That learning disability nurse said, "I think that people find it very difficult to have a conversation with a 40-year-old as opposed to an 80-year-old. I think it can feel quite difficult for a clinician." Sometimes it's because they don't meet people from minoritised ethnic groups or record ethnicity. A hospice director said, "I think our services are still set up for white middle-class people who can navigate the system, who have digital access and can read English." Some hospice services are working to engage with faith-based communities, going to mosques and having open days and training with local disability providers. Learning disability services often don't have the right equipment to support people at home, and by the time it's provided through social services, it's too late. So people can become stuck in hospitals. A senior nurse said, "He was in hospital for 2 months. He was actually fit for discharge, but there were just so many things that the home needed to get in place." Hospice services aren't making good records of how many people with learning disabilities they care for. This means they may not know if they need to focus more on people with learning disabilities. Learning disability services often don't recognise symptoms or when people are becoming more unwell. One nurse said, "We've got services who say, 'We don't work with people with learning disabilities, we're not registered to do this.' Support staff don't have the specialist training or recognise or provide end-of-life care." A hospice director said, "The care industry now, you go in, you do your bit, and that's it. We no longer have those tea and sympathy visits like community nurses used to do. Those old relationships are really valuable." People might be recognised better through good health checks or digital tools that track their use of health services. A GP said, "But if it's a poor quality health check and health action plan, it's meaningless." This might happen more if hospices and GPs work with learning disability services, share training and expertise, as we found in some parts where this outreach is happening. Services need to begin making end-of-life care plans at an early stage. This would help them to make good decisions when people become ill. Commissioners also need to start planning ahead, finding and paying for approaches that work for people with learning disabilities. There were some examples of this. The hospice director said, "We run pilots. We go back to commissioning saying, that's what services need to look like, and then we try and get funding for those services." There are very few learning disability focused healthcare professionals in general healthcare services in England, but they often are really important for delivering good end-of-life care and commissioning the right types of services. This learning disability nurse working in commissioning said, "I can't find anybody with a similar role to me in the UK." Our conclusions. All services need to make better records of palliative and end-of-life care needs for people with learning disabilities. This will help services and commissioners to make better decisions. Families and support staff often have to speak up for people. This is often harder for people coming from different ethnic minorities. Better recognition of people's healthcare needs is needed. This might come through more specialist roles, digital tools, and improved learning disability health checks. There was a really promising tool in one of the sites which is tracking healthcare data within GP records and predicting when end-of-life care needs may arise. We will track how useful this is in our current research. Thank you.
Thank you, Louise. That's very important work.
Yeah, and interesting, wasn't it?
Yeah.
Really, really good. So, shall we bring some people in?
Yeah.
It was. Can you remember who was waiting to help answer some questions? We've got.
Now we're going to bring in my colleague Fred and Ned to answer the questions.
We've got lots of Neds and Freds and Freyas. It's
Yeah.
Ned and Freya are going to answer the questions. So we have. So thank you for that. So and really welcome Freya and Ned there. You have so many questions and comments in the chat that I'm actually a little bit worried that we're not going to be able to get through them all. But we are noting them all, and it's really, really important. So before I put some of these questions to you, Freya, and to you, Ned, there are a number of questions about sort of how we work together and how this links into other projects across the country, whether we're working and raising awareness there. We do have a very large research advisory group that represents a lot of organisations, but part of the reason we're doing these webinars is also to get you involved. And so if you are working in an organisation and you think, actually, we need to know about this, we need to work with you, get in touch, either via the website or email one of us, and we'd be delighted to work together. But let's crack on and put some of these questions to you. Freya, I'm going to start with you. There's lots of questions about numbers. I think a lot of people were feeling a little bit like this. So one of the questions is, I think we're only looking at adults, is that right? Just people over 18, yeah. And did you have anything, did you look at the number of people whether people were more likely to die in hospital, the place of death?
Yeah, it was very limited in the information that we had. It was limited to home, but that could include some supported living homes, communal establishment, which included hospitals or other, and there were very few other. So yes, people with learning disabilities were more likely to die in the communal establishment, but we weren't sure whether that was because they're probably more likely to live in residential homes and communal establishments. So it was hard to know, in all honesty. Yeah, we'd need to look at it with more detail.
Yeah, we weren't sure whether home and communal establishment for many people is the same, isn't it, for people with a learning disability? And did you find that there were any differences? Somebody answered Emma's question. Were there differences in the care? Could you see that between people who died within a week of being recognised as being end of life and people who lived a little bit longer after that? Or did you not compare those two?
I didn't look. We could see that they were more likely to die, but no. What we did notice is that after, I think it was 90 days, people with learning disabilities and those without learning disabilities were about the same. So it's just that first bit of time where we think that perhaps they're just picked up too late, I think.
Yeah, and I think we found that when we looked at all these results, didn't we, Freya, and actually in the group as well, that we had so many questions that maybe can only be answered by the sort of work that Louise and Ned and all of us are doing, who are actually going out there. Because there's a question from Maria who said, if people are not going into hospital, that was a question for you, Freya, but I think it's Ned who can probably answer this more clearly. If people are not going into hospital, who then is involved in their care? What are the expectations of the health and social care professionals and of families? And is there enough support? So can you say anything about that, Ned, from the early findings, talking to managers and people in the field? Is there enough support, and what happens when people You need to unmute yourself. You are unmuted, yes.
Yeah, I think, can you hear me? Yeah.
Yes, we can. Hi, Ned. Good to see you.
Brilliant, yeah. I think that a lot of services are seeking the support of hospices and other training around end-of-life care. That's not always possible for them to receive it. They don't always have the funds. They don't always have the time to give to staff and those kinds of things. And local authorities aren't always providing them with the funds to train their staff when required. So there is certainly a movement towards better training for social care staff around healthcare and end of life, but there's definitely a long way to go in terms of having social care staff that are able to identify healthcare issues and then also respond to them.
Yeah. And did you find that there was, you know, a number of our researchers have also been going to these areas and listening and talking to staff and managers. The issue of funding often comes up. Is that something that you found in this part of the project when you've spoken to commissioners and senior managers, whether the difference between healthcare funding and social care funding, and you know, when somebody's needs increase, then the difficulty of discharging people home to hospital, home from hospital, because of equipment, funding issues?
Yes, so often learning disability services don't have the right kind of healthcare or supportive equipment or facilities at their services. And so when a person goes into hospital with a healthcare condition and they need better support and equipment outside of the hospital, those services don't have that right equipment. And then although those services are doing everything they can to get that equipment, it's often expensive and funding isn't being provided to them to enable them to get that equipment. I do know at least 2 service organisations that are campaigning and fundraising to create and develop end-of-life care facilities in their services, but they've been doing this for years and it's a hard slog. So it's not something often that's the services can help, even though they want to provide that support.
Yeah, and I'm sure we'll learn a lot more about those issues as we're doing our field work, as it's called, that we're going out and listening to people more in those 4 areas that Louise mentioned. Freya, there's also a question that's come in, and I'm not sure that, again, your work package, is able to answer that. It's about recognition. Why do we think that people, also for you, Ned, actually for all of us, why do we think people with a learning disability are maybe not recognised quite late? You know, they're quite close to death and people realise that they have an end-of-life care need. And that was only for about 1/4 of people. The other people who died, the need wasn't noted at all in the numbers.
Yeah, I think some of it's communication issues. I think there's also, I think there's a tendency to sort of say everything's about the learning disability, and you kind of miss other things that are going on, you know. And it's also training. I mean, you know, it's not specialist learning disability doctors that are making, you know, that we're looking at. We're looking at general practitioners, and they've got a lot of, you know, things to look at, and they're very general. So perhaps they just need to, you know, there needs to be some more training available for them.
And it is something that we are specifically looking at in a work package that's starting just now in the DAPPLE project, where a couple of our colleagues, Andrea and Becky, are meeting, you know, with healthcare and social care professionals to see how that early recognition of the need to provide end-of-life support or more specialist support, how we can recognise that sooner. So that is, hopefully we'll be able to tell you that in the webinar, probably not until next year actually. We've only just started that bit of the work, but there's quite a lot going on there. I am going to bring in another speaker who is not even know that he's a speaker yet. But so there's a question here. I think I'm looking sideways because there's 2 people called Fred and Joe who are sitting here. Can you just come in and the 2 of you, there's a question: how are you managing to do this work with a group online? How easy or how difficult is that? Here's Fred.
Hello,
Fred.
hello everyone.
And there's Joe. She'd already got her Christmas hat on, but do you just want to say something about the online meetings and how you're managing that? Because it looks quite tricky. People all over the country, isn't it?
Yes, and it was just really important to us to involve people with a learning disability from the different study areas in this group, and that's why we're meeting online, because we're all in the country, and we're doing this really important, serious work talking about this project, and but around that we do spend quite a lot of time together, sort of just settling into the meeting. We play games beforehand, before we get into the serious work, and then always leave time at the end of meetings to sort of reflect and check in with each other and make sure everybody's okay. It is difficult, and as we're learning as we go along, but we've got an amazing group, and we're really looking forward to carrying on working together.
Yeah, and it's Sunny and Amanda, you really helped to run that group. And there's another person I'm helping to run it, but I won't bring him in quite yet because he looks different from his usual attire. Which actually leads me. I know it is a quite short webinars, and this is the second in a series. We're going to run them every 3 months. A lot of what oncoming ones are going to be about the DAPPLE project. So I'm going to tell you a little bit more about that. But let's just say thank you to Freya and to Ned for coming in, and and also to Louise for a wonderful presentation. As I say, it is quite short, but there'll be lots of other things that you can find out about. I'm sure there'll be papers if you're somebody who likes to read complicated papers and articles. So thank you. That leaves us to really sort of announced to say a thank you to the whole team, and I think we're stopping because shall we put our hats on for the next part of our day, because we are ready for our Christmas celebrations. Here you do that as well. So this is the last day the whole team is together in the office. I think there's somebody else who's just come. Who's going to come along. There's somebody else. And I will tell you about the next webinar, which is on the 4th of March. We will put the link to the registration. Oh, ho, ho, ho.
Ho.
We put
What
the
have I
link.
got for you? Yes.
What have you got for us? It's not Richard, is it? It's Father Christmas.
Yeah.
So there's the 5th of March, we're going to have 2 more presentations. One is on the literature, what we found out in literature, and the other one is Andrea, one of my colleagues, is talking about a small study on how people communicate together in a hospice setting, people with learning disabilities and staff. So we'll put up a slide with a registration link, and in the meantime, all we can say is, we wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas. Happy New Year.